Gaze-feet interaction with medical images to support radiological interventions. During neuro-radiological interventions, which are minimally invasive, image-guided diagnoses and treatments of medical conditions, physicians need to interact with medical image data, which cannot be done directly while their hands are occupied when they are operating on a patient. We proposed a novel user interface that combines a clinician's eye gaze and foot presses as input modalities to interact with radiological images. A mobile eye tracking device and tactile floor were used to control software which mimics an angiography system's graphical user interface. Sensitive areas on the floor were defined for foot input, and the gaze is used for course selection of a viewport. In the first multimodal setup, M1, gazing inside a viewport with 1.5 seconds dwell time selects it. Image manipulation is done using the foot as long as the gaze focuses inside the viewport for longer than 1.5 seconds. The second multimodal setup, M2, requires a triple tap with the foot while looking at the viewport to confirm the selection. Images can be manipulated using foot interaction after this. In our first study, the multimodal setup M1 was compared to gaze-only interaction G and foot-only interaction F. Setup M1 performed comparably to foot-only interaction F, but significantly better than gaze-only interaction G. The second study revealed no significantly faster task completion times for the multimodal setup M2 compared to setup M1 and foot-only interaction F, but fast viewport switching via gaze. Our analysis of unsuccessful interaction attempts showed difficulties when gaze and foot are used simultaneously. Gaze is an excellent modality for pointing tasks, but can interfere when other body parts are used for interaction. We identified losing the viewport selection during multimodal interaction as the main limitation of our approach. We contribute to HCI by evaluating when to use gaze-only interaction, foot-only interaction, and a multimodal approach.